New tonight, the pandemic impacting your child's health in unexpected ways. Pediatricians say that scoliosis is not being detected as early in many kids, and it could make future treatment even more challenging. CBS 46's Adam Murphy is live at Children's Eggleston Hospital in DeKalb County with the details. Adam.
Good evening, Rick. With sky-high COVID concerns right now, many of the health officials here at Children's Healthcare of Atlanta tell me they've seen an increase in the number of undetected cases of scoliosis. There is cause for concern at Children's Healthcare of Atlanta. Medical professionals have seen a spike in children with cases of scoliosis.
We see patients coming in with larger curves where we would have hoped to catch them earlier. We also see more patients coming in with back pain and with poor posture as a result of inactivity from the pandemic.
Health officials suspect that a lack of school screenings due to virtual learning at home may be to blame. Children are experiencing back pain or tech neck, which often goes undetected.
What that looks like is typically the pediatrician or the school nurse is going to ask the patient to put their hands together and bend forward kind of towards their knees and look at them from behind. From behind, if someone who has scoliosis, you can see a prominence in some section of the spine. So usually we see that up at the thoracic section, which is where the ribs are.
Statistics show that about 2 to 3% of children have scoliosis. Cara Seeley was one of those individuals.
My shoulders were to the side and I was even leaning forward. So my left shoulder was beginning to rotate. And I'm like, I don't know what this is.
Early detection is key to avoiding surgery. Warning signs include uneven shoulders, uneven hips, or ribs sticking out in one area.
I understand the concern with going into the physical doctor's office or the hospital, feeling the risk of possibly getting COVID, but you want the proper diagnosis. And the longer that you take to get that, the worse it could become over time.
If someone has back pain, kids should not be in pain. If they're experiencing back pain more than a couple times a week, you need to go see the pediatrician.
And the bottom line here is make sure that your children are getting those regular checkups if they're not getting the screenings in school, because when it comes to scoliosis, it could mean the difference between having physical therapy or surgery to recover. We're live outside Children's Healthcare of Atlanta, Eggleston in DeKalb County tonight. Adam Murphy, CBS 46 News.